I lead on a project which is called All Move in Erewash, and we call it AMiE for short. And the aim of the project is to understand how we can create fairer access for people living with long-term conditions and disabilities to move more in their everyday life. The aims really are to try and influence the wider system and to try and just kind of join up the services and the provision that we do have. Kind of professionals across Derbyshire. And a huge part of the work has also been to have conversations with those people with lived experience to really understand what their support needs are and really go a bit deeper into what some of the barriers are in helping them to be more active or to move more.
We recognised that there were growing inequalities in people's activity levels between those who didn't have a disability and those who do have a disability. So All Move in Erewash was really introduced to try and look at how did we kind of take a more systemic approach to working differently to support that change in behaviour levels. Recognising the complexities in the system, that people with inactivity isn't necessarily as simple as it seems. Like, it's not necessarily somebody's choice to be inactive, it might be the environment that they live in. So it was really, really important, I think, to get right down into the depths and build that genuine understanding that we could then build that relationship with the system to create a space that enabled and empowered people to choose to be active, and started to really transition it from a service or a provision to a choice that an individual has. So the work really started with a core group of partners who now most of them form an All Move in Erewash steering group to continue to support the evolution of the work. And then outside of the steering group, we've got a really broad network of stakeholder partners, and their role is just as important as the steering group itself. So they vary from individuals in the community, voluntary and community groups and organisations, frontline workers, so they might be physios or OTs or people supporting people back into employment who have got the trust of the audiences that we're trying to reach, so that we can really take a systemic approach to creating change.
The AMiE work, I was involved very early on, so with the development of it and supporting that work from with my ICB Integrated Care Board hat on, and I'm part of the steering group, and so I will then look at how do I link in with partners to promote the initiative, I suppose, and try and get buy-in from those partners who might be more tricky to connect with.
And I think the reason that the stakeholder network is so varied and as unique as it is the role that some of our steering group members play in extending that network beyond its reach of traditional sport and physical activity partners. So working with the PCN and the ICB, I think we've connected to parts of the health system that probably wouldn't have been in the conversation before. Obviously working with the CVS, again, that network of voluntary and community sector partners, recognising their role in this space. I think because from the outset, the approach was co-designed by all the different members of the system.
What's your favourite way to move? One of the common themes has been around the support that they get from professionals. I've been hearing about how sometimes they'll go to a GP appointment or they'll see a healthcare professional and they just don't feel listened to. The professional that they're working with doesn't always provide them with the best support because they'll kind of make an assumption and maybe just kind of signpost them to something quite generic without really understanding their situation. What I've been doing this year is trying to provide and trying to upskill professionals within Erewash to have the skills to feel more confident and more competent to have better quality physical activity conversations with people that they're supporting.
Well, GPs, nurses, healthcare assistants, physiotherapists, pharmacists are all so important when it comes to health and well-being. And if they are endorsing physical activity, then people are more likely to take notice and to do something about it. It's not always easy to engage with GP practices. They're very busy places. There is a lot going on, and understanding the impact of physical activity on health isn't always necessarily at the top of their minds as clinicians. We've been able to bring in subtle little kind of influencing factors like the physical activity champion training. Now, there was one particular GP practice that really picked up on that. And once we have one GP practice, interested in becoming an active practice and doing things differently, that then ripples through into other areas. So just one tiny little drop makes a massive difference. It might take time and it is a bit more of a social movement, but it actually will happen. And we've got some training around motivational interviewing. So when people have talked to Sarah in some of our previous Quest sessions, which are our training sessions, she's been able to drop the idea in of like different kind of conversations, quality conversations, a way of understanding people in a better way. And as a result of that, they'll get some motivational interviewing awareness training.
All of the social prescribing team, which is 8 members of staff, have received motivational interviewing training. We have a lot of conversation with clients. Motivational interviewing is more about, rather than cheerleading, it's about those affirmations of why you've made those changes and then supporting those positive changes.
Some of the insights that we got from the All Move in Erewash survey were used to design the proposal for the bid to Mind for the physical activity towards mental health. We are going to deliver 6 courses of 6 sessions of physical activity, different physical activity every session, to give people a taster of the sorts of things that they might find helpful to them. Because I feel that many people are directed immediately towards the sports type, gym type activities, and we provide a whole range of activities that are really good for your physical health, but are slightly different. So chair-based yoga, Pilates, Tai Chi, the outdoor activities, foraging.
One of the really exciting developments as part of the project, certainly over the last year or so, has been the AMiE champions coming into post, into role. And I think it's really important, we know from a lot of the work that we do as an organisation, for disabled people and those with long-term health conditions to see people like them, see people like me. And so those role models, those ambassadors are absolutely critical. And I think the fantastic thing about the AMiE champions is they're all local people, they're all sharing their stories, they're all very different, different activities, different lifestyles, different ages, different backgrounds, but they've all come together and united around getting involved in activity. And I think that's an area where that residents' voice has really been brought to life, and I'm really excited for the future to see just how those champions can get their message out.
I think there has been huge progress made already within the last 12 to 15 months, but there is still a long way to go, and I think it's just recognising that some of the long-term change can take a bit more time, maybe even a number of years.